Hello guys, welcome to my channel. So today we are going to discuss about wrist joint special test part 1. So in this part 1 we discuss about the ligament capsule and circulatory special test. Then in part 2 we discuss about the muscle and nerve. So for part 1 test for the ligament. So the first one is the thumb ulnar collateral ligament test. So in this test, one hand of the therapist stabilize the base of thumb, other hand hold the thumb into extension. Apply valgus stress on metacarpophalangeal joint. If valgus move more than 30 to 35 degree, it indicates tear of ulnar collateral ligament. If partial tear, it lags below 30 to 35 degree compared to unaffected side. Then the next one is the test for tight retinacular ligament. So in this test, we place the proximal interphalangeal joint in neutral and flex the distal interphalangeal joint. If during flexion of the distal interphalangeal joint, the proximal interphalangeal joint is flexed, then it indicates tight retinacular ligament. If the distal interphalangeal joint is not flexed but proximal interphalangeal joint is flexed, then it indicates capsular tightness. Then we go for the linear triquetral ligament ballotment test or the Guns test. In this test, examiner grabs the triquetrum between thumb and index finger and the lunate with thumb and index finger with other hand. Then examiner move lunate up and down. If pain and laxity, it indicate lunotriquetral instability. Then we go for lunotriquetral shear test. So in this test, elbow is flexed with neutral rotation. One hand of the examiner grabs the patient wrist. So thumb is rest in patient palm. Apply shear force on lunotriquetral joint. If pain and crepitus is present, then test is positive. Then next is the sock test or finger extension test. In this test, patient sit, therapist hold the patient wrist in flexion, ask him or her to extend the finger. If test is positive, it will indicate there is some inflammation of the bone. Then next one is the Watson test or scaphoid sip test. In this test, elbow is flexed, forearm is pronated. One hand of the examiner take patient wrist in full ulnar deviation, then slightly extension holding the metacarpal. Examiner press the thumb of other hand against the distal pole of the scaphoid and palm side and to prevent it from the moving towards the palm. One first hand examiner radially deviated, slightly flex the holding scaphoid. Then if test is positive, there is pain on wrist which indicates scaphoid sublux or sipped over the dorsal rim of radius. Then the next one is the scaphoid stress test. In this test is same as a Watson test, but in this test patient do actively radial deviation. If excessive laxity is present, then or pain or crank is present, then there is indicate of the scaphoid subluxation. So scaphoid stress test is positive. Then the next one is the piano key test. In this test, patient both arm is pronated. Examiner stabilize the patient arm in one hand and index finger push down the distal ulna. Then examiner push down on the distal ulna. If positive test, it indicate pain, instability on the distal radio-ulnar joint. Then the next is supination lip test. In this test, patient seated with both the forearm in supinated position and elbow flexed to 90 degree. Then flat the palm on the table, and then therapist apply resistance on the above the palm and ask the patient to lift the palm on the table. If patient having pain on ulnar side, it indicate triangular fibrocartilage tear. Then the axial load test. In this test, patient sit, examiner stabilize the patient wrist with one hand, then examiner grabs the patient thumb, apply axial compression. If pain and crepitus, it indicate positive test for which indicate fracture on the metacarpal bone. The next one is the pivot shift test or midcarpal joint test for pivot shift test. So in this test, patient sit with elbow flexed 90 degree, hand is fully supinated. Patient one hand radially deviated and other hand stabilize the forearm. And the patient hand take into full ulnar deviation. A result of capital shift away from the lunate indicate injury to the anterior capsule or interosseous ligament injury. The next one is the grinding test. The test, examiner hold the patient arm with one hand, grasp the patient thumb below the metacarpophalangeal joint. Then examiner apply compression and rotation. If pain present, it indicate degenerative disease. Then there is Lynch's test. So in this test, examiner stabilize the metacarpophalangeal joint SAPT with one hand and other hand push the thumb head up the metacarpophalangeal joint dorsally, then palmally. Then if patient having pain, it indicate second and third metacarpal joint ligament laxity. Then there is sitting hand test. In this test, patient place both hand and arm in a chair, then push the whole body using it. If there is wrist pathology, it cause pain. Then we go for test for circulation. So first is the Allen's test. So patient asked to open and close the hand several times as quick as possible and then squeeze the hand tightly. The examiner thumb and index finger are placed over the radial and ulnar artery, compress them, placing one thumb over the each artery posterior aspect of the arm for stabilization. The patient then open the hand while pressure is maintained over the artery, and one artery release pressure over that artery. See if the hand is flush. It can cause that if there is a circulatory problem, test is positive. Then go for the digit blood flow. In this test, there is compression of the nail bed, then release. If the color is written within 3 seconds and if return is take place longer or more than 3 seconds, then there is some arterial insufficiency to finger should be suspect. Thank you.